I'm Evan Johnson, MD and neurologist, specialist in Parkinson's and movement disorders here at Piedmont Fayetteville Neurology. When I look back, I think I probably had a sense of this. But when I went to college, my first summer, I worked in all kinds of different clinics. But the clinic I found myself asking to come back to was neurology, and specifically Parkinson's clinic. Our organ systems are almost predicated upon our using our bodies in order to work well. Parkinson's wants everything to be smaller and slower, and that includes their gut motility. So making sure that they're moving, even though that can be a key issue for them, that makes a big difference. Even simple things like blood flow back to the heart. So while medications have not been found to affect whether someone develops Parkinson's or if it progresses, exercise has been. And a large part of that is its effect on your natural dopamine levels and that motor control center, which is at the heart of the issue. So we're here largely because the CEO of the hospital, Steve Porter, had a vision that he wanted to bring some of the higher level care for Parkinson's to this area, to this community. The main thing we talk about when we think about more advanced treatment for Parkinson's is something called deep brain stimulation, or DBS, which is the surgery that we can use in order to provide patients the same kind of benefit that they might get from medicine, but without the burden of taking medicine throughout the day. The process behind it is two relatively thin leads are placed through the skull to what I would refer to as a tremor center, then providing an electronic stimulation that calms down the main symptoms that you might see in Parkinson's disease. And it provides it in a consistent way, and it's programmable. In people with Parkinson's, usually one side of the body is affected differently than the other. So the stimulator, unlike medicine, can provide more specific treatment to that one side and maybe spare the other. One challenge that we have is really getting the message out to everyone about what can we help with. It's not enough to say that we're a Parkinson's clinic, because we help people with essential tremor, restless leg, Huntington's, and many other conditions in that umbrella. But the other thing that we offer is Botox injections. It's a powerful medical tool for headaches. We also help folks if they've gone through a stroke and are developing what we call spasticity, a tightness in their arms or the legs. And using that also can make a very big difference. We're here for their quality of life, which is really the point of anything we do as physicians. This clinic does not thrive without our staff, without our support team, without our office manager, without the leadership, without those components. Even if I were a good physician, that's not going to be enough to make this clinic successful. So Piedmont's ability to build these strong teams and make sure that the patients are cared for in the way that they should, I think is probably the strongest aspect of what we get to do here.